All right, dog owners. Here are 13 warning signs that your dog needs your help. Now, you've probably heard that having a dog increases your life expectancy, and that's totally true. In fact, owning a dog reduces the risk of a severe heart attack by 3%. That may not sound too impressive, but in reality it means 30,000 lives saved per year in the United States alone. They do so much for us, but our furry friends might also need some saving when it comes to their health. And since they can't tell you when something is wrong, you need to pay attention even to the slightest changes in their behavior and take the necessary measures immediately to keep your dog safe and healthy. 1. Coughing dogs can suffer from something called kennel cough. This condition doesn't require any special treatment and usually goes away on its own within 2 weeks. The only issue is that it's highly contagious, so if you have more than one dog, you might want to keep the affected one away from the others. Kennel cough can be more serious for puppies and flat-faced breeds, such as boxers, bulldogs, pugs, and Pekingese. This is because their face shape can cause additional breathing difficulties. There's also a cough-like sound that you might hear occasionally in small breeds. This is called reverse sneezing and can indicate a slight throat irritation. It typically goes away on its own, but persistent coughing or reverse sneezing that lasts for more than 2 weeks is never normal. It could be related to heart or lung disease, heartworm, bronchitis, pneumonia, or a tracheal collapse. 2. Excessive panting. Dogs pant to regulate their temperature, but panting excessively without reason can indicate heart disease, lung problems, or pain. If your dog shows bluish gums, weakness, or faints, seek a vet immediately. Flat-faced breeds like bulldogs and pugs struggle more with breathing issues. Avoid intense exercise in the heat and keep your dog well hydrated. 3. Abnormal restlessness. If your dog suddenly seems anxious or scared for no reason, pacing, shaking, or whining constantly, this could indicate various health issues including mange, rabies, Cushing's disease, or heart problems. It could also be caused by chocolate poisoning, which, as you know, should never be given to dogs. Chocolate is highly toxic to them and can lead to theobromine poisoning. If you suspect your dog has eaten chocolate, take it to the vet immediately. 4. Vomiting. Dogs may vomit occasionally, even when they're not seriously ill. My own dog, for example, prefers to vomit at 2 in the morning. Go figure. Sometimes they eat too much or too fast, something in their food doesn't agree with them, or they play too soon after a meal. However, vomiting can also be a sign of gastrointestinal illness, pancreatitis, kidney disease, or parasitic infections. Dogs occasionally vomit if they've eaten too much grass or gotten into the trash, but if your dog vomits multiple times a day, call the vet. Blood in the vomit is a major red flag, as it could indicate that your dog swallowed a sharp object that is irritating its stomach. 5. Swollen belly. A distended abdomen could simply be a sign that your dog ate too much, but it could also indicate digestive disorders, hormonal imbalances, or even internal bleeding. Undiagnosed abnormal swelling in the stomach could be life-threatening, as it puts extra pressure on the chest cavity and makes it hard to breathe. A swollen belly in dogs can also be a symptom of an extremely dangerous condition called gastric dilatation volvulus, GDV, also known as bloat. If left untreated, this condition can be fatal within hours, which is why it's often called the mother of all emergencies. This happens when food or gas stretches a dog's stomach to such an extent that it cuts off blood supply to the stomach, leading to tragic consequences. Bloat and GDV can be caused by swallowing air or exercising too hard after a meal. You need to be extra careful if your dog is a deep-chested breed like a Saint Bernard, Weimaraner, or Great Dane. Eating from an elevated bowl given only one meal per day, a fast eater, from a family history of GDV or bloat. A senior dog, the risk is highest between 7 and 12 years old. 6. Intense bad breath. Bad breath could indicate periodontal disease, bacterial infections, or kidney and liver problems. If there is tartar buildup, inflamed gums, or difficulty eating, dental treatment may be necessary. A sweet smell may indicate diabetes, while a urine-like odor could signal kidney failure. Regular brushing and vet checkups help prevent these issues. 7. Loss of appetite. If your dog refuses food for more than 24 hours, it could be a sign of stress, pain, fever, or digestive problems. Dental issues such as gingivitis can also make chewing painful. If your dog's loss of appetite is accompanied by lethargy, vomiting, or weight loss, seek veterinary care immediately. Early diagnosis can prevent serious complications. 8. Lethargy. If your normally energetic dog suddenly refuses to play or spends all day lying around, this could be the first sign of a serious issue. Weakness or lethargy in dogs usually accompanies infections and major illnesses, such as diabetes, hypoglycemia, and anemia.
Hey there! I'm Lewis, the real talent behind this channel. I handle creative direction. My human just does the boring stuff. Let me know if you like this video by subscribing to our channel.
9. Unexplained weight loss. If your dog has lost 10% of its normal body weight, this could indicate a metabolic disorder, kidney or liver problems, neuromuscular disease, or cancer. Many people assume that weight loss is normal for aging dogs, but experts say that's not true. If your senior dog has started losing weight, visit the vet immediately. 10. Tremors or seizures. Shaking can be caused by cold, fear, or stress, but persistent tremors might indicate neurological disorders or poisoning. Seizures can be signs of epilepsy, liver disease, or toxicity. If your dog has a seizure, keep it safe and don't restrain it forcefully. If the seizure lasts longer than 2 minutes, take your dog to the vet immediately. 11. Excessive licking. If your dog is constantly licking a specific area, it could be a sign of pain, flea allergies, or skin irritation. Dogs may also lick strange surfaces if they have gastrointestinal issues. If the licking is obsessive, a vet visit is necessary to rule out infections or anxiety-related behaviors. 12. Changes in urination. If your dog is urinating more frequently than usual, it could indicate diabetes, especially if it also drinks more water than normal. On the other hand, if your dog urinates too little or has difficulty peeing, it might have bladder stones or a urinary tract infection. These conditions can be extremely painful and even life-threatening. If your dog stops urinating completely, it could die within 24 hours. Seek immediate veterinary care. 13. Hair loss or intense scratching. If your dog is losing fur or scratching excessively, it could be due to fleas, ticks, mites, or mange. Food or environmental allergies can also cause irritation. If parasites aren't the issue, it could be an endocrine disorder like hypothyroidism or a fungal infection. Redness, sores, or crusts require immediate vet attention. Stay alert to your dog's behavior. Dogs can't speak, so any change in behavior, appetite, or energy level could be a warning sign. Observing small details can make a huge difference in detecting health problems early.